I'm pleased to stand with my freshman colleagues this morning. We often share the back bench, but today we bring our message front and center. The time has come for action on health insurance reform. We represent the North and South. For me, everyone comes from the South. But today, we see that no matter where you live in this country or what you do for a living, the cost of inaction is simply unacceptable. All of us can cite alarming statistics from our state. In my state, there are now 133,000 uninsured Alaskans. In raw numbers, maybe not much when compared to Virginia, Illinois, or Colorado. But in Alaska, that number represents 20% of the population. To me, and I hope to my colleagues on both sides of the aisle, this is unacceptable. Average insurance premiums in Alaska have doubled in the past decade to more than $12,000 annually. If we don't act, they will double again about the time my 7-year-old son starts high school, for families cannot afford that. Already, the average Alaska family pays a hidden tax of $1,900 in premiums to cover the cost of uncompensated care provided to people without insurance. And it will only get worse as time moves forward. The problem is especially tough for small businesses in my state because Alaska has a high proportion of small business owners, fishermen, float plane operators, construction contractors, independent realtors, and the like. 52% of all the jobs in Alaska are held by small business workers or self-employed. They know better than anyone that a broken healthcare system leads to lost jobs, reduced productivity, less investment, and stalled business growth. Just this weekend, I met with a small business town hall, and there was one clear message from them to me, to Congress. Do something, do it now. Each one cited their increases ranging from 14% to 41% in healthcare costs this year alone. That's why one of the best ways we in the Senate can strengthen and grow Alaska Americans' business is to pass meaningful health reform, not sometime down the road, but this year. I joined the small business majority earlier this year as it released a compelling report on the need for reform. The bottom line, even with middle-of-the-road reform, America's small business will spend $800 billion more than they need to over the next 10 years. If they can save that with just a middle-of-the-road reform, we can save that money and put it to best use. Considering that small business is driving economic recovery in America, that's huge. $800 billion saved, available for infrastructure, innovation, and providing stable jobs. It's not just small business that need reform. The Business Roundtable, which has been spoken about already this morning, which represents much bigger companies, released a report last week that says healthcare costs will triple over the next decade to nearly $29,000 per employee. There's plenty to debate about health reform in the weeks ahead, and I still have questions of my own. But here's one thing I completely hear from all across my state and across this country from emails and messages we receive. Support for health reform is truly support for America's businesses.